Welcome, folks, to another episode of Spilling Tea. Excuse me. I am your host, Tiffany Daniels. And, folks, today we're going to be talking about some non-evidence-based treatments when it comes to autism, such as the whole leaky gut theory and gluten-free diet treatment, just as an example. So, okay, we are going to read this article. It comes from the Autism Science Foundation. I will make sure, of course, to include the link for the article in the description. Okay. So, all parents want their children to lead healthy and fulfilling lives. Unfortunately, as parents of children with autism strive to help their children, they can fall victim to duplicitous claims that encourage them to try unsafe, expensive, and ineffective non-evidence-based treatments. Before bringing any treatment, parents should question whether a coherent scientific rationale behind it and think critically about its associated risks and benefits. They should also ask their healthcare practitioner whether treatment has been proven effective and safe in objective scientific studies, and whether those studies have been published in well-established, highly reputable, peer-reviewed medical journals. It's important to remember that anyone can start a journal or post a study on the internet to tout the efficacy of dangerous or useless interventions. Healthcare fraud is a huge business in the U.S., and parents of children with autism are often targeted. Fringe treatment providers prey on desperation and fear and deceive parents with numerous unfounded claims. To be considered evidence-based, a treatment must be thoroughly investigated in multiple well-designed scientific studies and show measurable, sustained improvements in targeted areas. A study's design largely depends on its focus and purpose, but there are some characteristics that well-designed studies tend to have. These include, but are not limited to, use of well-matched comparison groups, participants receiving the new intervention should be compared to a group of participants receiving a standard community intervention and or a group receiving no intervention. The comparison group should match the new treatment group in average age, gender distribution, diagnosis, level of functioning, and any other potentially confounding variables. Random assignment of participants to treatment/comparison groups. Pre- and post-test design. Performance on a given test is measured before and after the intervention measure change. Use of representative samples. Study participants should be representative of the target population. That is, a study testing an intervention for toddlers with ASD and average IQs should not use a sample of autistic school-aged children with uncharacteristically high rate of MR. Oh my gosh. So, folks, yeah, we won't get into that verbiage. Binding of individuals involved in the experiment. Where appropriate, investigators and participants should not know group assignments, e.g., placebo versus medication, in order to prevent biases during data collection. Use adequately large samples based on past research and statistical analysis. Below is an overview of commonly discussed treatments that are currently not scientifically validated. Biomedical non-evidence-based treatments. Chelation. We went a little bit over this yesterday. Chelation therapy involves administering chemicals designed to bind heavy metals and eliminate them from the body. Chelating agents have a legitimate use in treatment of poisoning from lead, mercury, and other metals. There is no evidence that supports chelation as a safe treatment alternative because autism is not caused by metal poisoning. In 2005, a child with autism died from chelation therapy. When the chelating agent bonded with the calcium in his body, and cost is hard to stop. No paper published in peer-reviewed literature has reported abnormal levels of mercury in individuals with autism spectrum disorder. Moreover, symptoms of mercury poisoning are unlike symptoms of autism, making chelation an impractical way to improve symptoms. Lupron therapy. Lupron is a testosterone-inhibiting drug used in treatment of precocious puberty, which is rare, and prostate cancer, as well as for chemical castration of sex offenders. Its use for autism is based on the hypothesis that testosterone magnifies the toxic effects of mercury. See above. There is no evidence that Lupron is safe or effective for the treatment of autism. In addition, it can have harmful side effects including hives, difficulty breathing and swallowing, numbness, tingling, weakness, painful or difficult urination, blood in the urine, bone pain, testicular pain, and osteoporosis. Hyperbaric oxygen therapy. HBOT has been proven effective for treatment of gangrene, carbon monoxide poisoning, the bends, and various other conditions related to oxygen in blood. There is no evidence to support ASD as an insufficiency of oxygen in blood. Evidence also fails to support HBOT as a safe or effective for the treatment of autism. Furthermore, the benefits of hyperbaric oxygen delivered in a soft-shelled chamber are no different than with a less expensive oxygen tent or nasal cannula. Gluten-free, casein-free diet. Those who promote gluten, protein found in wheat, rye, and barley products, and casein, protein found in dairy products, free diets claim that children with autism have leaky guts that allowed opiates to escape through the bloodstream and then travel to the brain and cause autistic behaviors. There is no evidence. Again, I'll say it. No evidence for this claim, and studies have been found that compared to typically developing children, children with autism have no more opiates in their blood. Furthermore, children on the GFCF diet have been found to have lower bone density than controls, which could lead to osteoporosis. A large-scale study of the safety and efficacy of the GFCF diet indicates that children on the diet had similar outcomes to those who were not on the diet. Stem cell therapy. Well, this is a new one. Stem cell therapy for autism is illegal in the United States, but that hasn't stopped some from offering this as a treatment for autism in Costa Rica, China, and other countries. There is no evidence that the treatment is safe or effective for autism, and no guarantee that the stem cells used in these countries are even human. Secretion injections. Secretion is a hormone that controls digestion. It is currently prepared from pigs as a synthetic human form is not available. The FDA has approved use of single doses of secretin in diagnosing gastrointestinal problems such as ulcers or impaired pancreatic function in adults, but has not formally approved the hormone for autism treatment. No data exists on the safety or the efficacy of repeated doses of secretin or its use in children. In a report, the National Institutes of Child Health and Human Development states that the efficacy of secretin in ASD treatment is currently unknown. Anti-fungal agent therapy. Some people believe that bacteria in the gut cause autism, and since antifungal medications can eliminate bacteria, they believe they can simultaneously cure autism. There is no evidence to support any antifungal agent as an autism cure. Importantly, treating children with antifungal agents is potentially harmful. Possible side effects include itching, irritation, burning, diarrhea, stomach pain, and skin rashes. Some antifungal treatments, including diflucan, excuse me if I butcher these, Spironix, Lemicel, and Nizorai, are absorbed in the body and can impede liver functioning over time. Vitamin supplements. It is important to maintain a healthy and balanced diet. To achieve this goal, healthcare providers may recommend nutritional supplements to people with and without autism. Use of supplements can be problematic, however, when they are misused in an attempt to cure an individual of autism. There is no scientific evidence suggesting that vitamin supplements can cure autism. Using supplements without consulting a healthcare provider can be dangerous. Some supplements, vitamin A, can be toxic when taken in high doses for sustained periods. Others may not contain what they claim. Raw camel milk. Raw camel milk has been alleged to cure autism-related ills with benefits ranging from improved eye contact and motor skills to decreased inflammation. Although it may be nutritious, there is no scientific research that upholds claims that raw camel milk is an autism cure-all. I'm finding some new ones myself. Marijuana therapy. Excuse me. Marijuana is an illicit drug whose use in ASD treatment is neither medically nor scientifically supported for the core symptoms of autism. Reported short-term side effects of marijuana use include distorted perception, impaired coordination, impaired thinking, problem-solving, learning, and memory. Long-term marijuana use has been associated with decreased learning abilities, increased risk of respiratory diseases associated with smoking, and decreased motivation. There are studies that are ongoing specific chemical components called cannabinoids for treatment of epilepsy. Nicotine patch therapy. Research studies have uncovered abnormalities in nicotinic acetylcholine receptors in the brains of people with autism, and some scientists have posited that core symptoms of ASD could be attributed to these alternations. Some findings specifically indicate a shortage of these receptors, leading some to believe that stimulating or increasing these receptors could eliminate ASD symptoms. Proponents of nicotine patch use in individuals with ASD believe that the nicotine released into the body from the patch activates and upregulates receptors and thereby reduces ASD symptoms. Despite having a rationale that is based on scientific findings, use of this treatment is not supported by scientific evidence. No clinical trials have demonstrated that nicotine patches are safe or effective in the treatment of ASD. Common side effects reported in clinical studies evaluating safety and efficacy of patches include skin irritation, sleep problems, including insomnia and nightmares, headaches, indigestion, and nervousness. Bleach therapy. In bleach therapy, an individual with ASD is given a diluted form of bleach orally or through an enema in an attempt to cure their symptoms. Bleach doses are given repeatedly. Supporters of this treatment have recommended that children drink the bleach mixture up to 8 times per day or receive an enema up to 3 times per week. The rationale for the treatment is that bleach can eliminate bacteria, parasites, yeast, and heavy metals, and consequently eliminate ASD symptoms. This treatment has been widely denounced for the harm it can cause, as well as its complete lack of scientific basis. Ingesting bleach can lead to severe fever, diarrhea, vomiting, and other complications, like, death. Excuse me. Missouri allergies, I'm telling you. Alright, transcranial magnetic stimulation. TMS is a procedure in which magnetic fields are used to stimulate nerve cells in the brain to enhance or reduce certain functions. TMS is currently used to treat mental illness, including depression and schizophrenia. The most commonly reported short-term side effects include headaches and scalp discomfort. Therapeutic TMS is relatively new, so long-term side effects, if any, are unknown. Investigations into the efficacy of TMS and ASD treatment are currently underway, but presently there is no evidence to support its use. Psychological and behavioral non-evidence-based treatments. Therapeutic horseback riding. Horseback riding therapy for individuals with ASD aims to foster motor communication and social skills while improving responses to external stimuli. Although a few studies touting the benefits of therapeutic riding have been published in peer reviewed journals, they're either mainly descriptive, involve small samples, or rely on poor outcome measures, and thus cannot support the therapy as useful, evidence based intervention. Okay, guys, I'll read the rest of these, but I think we've covered what we wanted to cover. Okay. Dolphin-Assisted Therapy. When undergoing Dolphin-Assisted Therapy, DAT, an individual with autism swims, touches, and interacts with dolphins. Alleged benefits of dolphin therapy include improved emotional control and communication skills, as well as increased attention. Some proponents also claim that the emotional experience created by DAT helps individuals become more receptive to more conventional treatments. There is no scientific evidence that suggests that DAT's efficacious and long-term improvement of ASD symptoms. Moreover, DAT involves significant safety risks, given that dolphins are powerful animals that are capable of harming humans despite extensive training. Prism glasses. Prism glasses alter the visual perceptions of individuals with ASD, or are thought to improve behavior and challenging vision related symptoms as a result. Supports, Supporters believe that some individuals with ASD suffer from distorted perception and compensate using abnormal movements and postures such as head tilting. Prism glasses aim to ameliorate perceptual distortions and aid visual awareness, decrease in sensory seeking behaviors, organization, gait, eye contact, mood, facial expressions, and fine and gross motor skills. Unfortunately, these benefits have no scientific backing. No studies with the strong experimental designs have supported the use of this expensive therapy in individuals with autism. Holding therapy. Holding therapy is based on the erroneous notion that autism is a disorder of attachment caused by a parent's failure to bond with their child. This is the refrigerator mother theory. In a holding therapy session, a caregiver physically restrains a child with autism in order to force eye contact and repair attachment. This treatment has been deemed ineffective and dangerous. There is no scientific evidence suggesting that holding therapy works, and fatalities have resulted from its use. All right, folks, there you have it. That's a bunch of myths just covered in just one article. Now, what I don't like about this Autism Science Foundation is it does seem very anti autistic people. It's, again, that assumption of deficit. However, what they are reporting on in regards to the science is important. Non-evidence based treatments has caused all kinds of major health issues. Some folks with autism have even died, as have been stated here in this article. When you're dealing with folks who absolutely believe things like the leaky gut theory, or you have people that absolutely believe things such as the MMR has caused all this and the heavy metals have caused this, those folks become prey to what I call the modern world's snake oil salesman, where they peddle you very expensive treatments and more often than not are more likely to harm rather than actually help the child. There is a reason why I keep telling you folks to follow the science, talk to your doctors. It's not simply because of my health. It's not because I'm judging you in regards to what you feel one way or the other in regards with your child with autism. Not when it comes to the science. Day-to-day life, I judge you a lot. But when it comes to the science of it all, when you believe these unproven things, when you take your medical advice from social media and mommy blogs, you are more than likely to fall victim to one of these snake oil salesmen and can actually do irreparable harm and damage to your autistic child. In fact, there are actually medically approved interventions that we are now proving years later are mentally damaging to your autistic child. So, keep your eye on the science. Make sure you're not falling victim to these snake oil salesmen. And also, speak with adult autistics in regards to what treatments they went through and what their experiences were with them, especially in regards to ABA. You might be surprised. All right, folks, this is all I got for this afternoon. Now, I'll have another video. You know what I mean. Now, we don't have that many views on this channel, and the few that we do get do tend to get removed by YouTube. So if you could, please don't forget to hit the like button, hit subscribe. Don't forget to hit the comments. If you would like to share this channel, remember the home screen is still wiped clean, so please hit the video tab, hit the share button under any of these videos, hit copy the link, and then you are able to post it and share it throughout your social media. And folks, we here at Spilling Tea do appreciate your time, and we hope you all have a good one. Thank you.